We are really fortunate today to have as our speaker Dr. Charles Weijer, and I've had to practice that several times, so I think I got close. Is that right, Charles? So, good. And I've had the pleasure of getting to know Charles over the last day, and it's been a huge delight, and I think you will be happy that you're here today to hear this particular talk. Charles is the leading expert in the ethics of randomized controlled trials. He has numerous publications on the duty of care in clinical research, the ethical analysis of study benefits and harms, and empowering communities in research. These publications have been broadly influential. From 2008 to 2013, he co-led a collaboration that produced the first international ethics guidelines for cluster randomized trials, I think known as the Ottawa Statement, and you can find those in the literature. From 2014 to 2018, he collaborated with Dr. Adrian Owen on a project exploring the ethics of functional neuroimaging after severe brain injury. His current work explores ethical issues in pragmatic randomized controlled trials that evaluate health interventions in real-world conditions to better inform patients, health providers, and health systems managers. This project was funded by the Canadian Institute of Health Research. It's funded from 2017 to 2021, and brings together a really interesting research team as a sort of side comment, in that it's composed of philosophers, biostatisticians, and trialists from 5 countries. I think we ought to sort of strive for that here. In 2008, Charles co-founded the Rotman Institute of Philosophy, which is dedicated to fostering collaboration between the humanities and the sciences, and serves as the Institute's first director. In 2014, he received the Western's Helmuth Prize for Achievement in Research, and in 2016, he was elected to the Royal Society of Canada. The process, if this is the first CARES panel that you've been to, is we will invite Charles up, and he will give some introductory remarks around the topic of the ethics of community-engaged research, that will also bleed over to pragmatic trials and cluster randomized trials, which all share some very common ethical challenges. We will follow that with 2 OSU researchers who will speak about their experience in this space. It will be Abby Shoben from the College of Public Health and Susan Melsop from the Department of Design, different perspectives. And then I have a few questions to get us started for leading the conversation, and then we want to open up the floor for conversation with your questions. So as we work through this, I would encourage you to write down questions that you might have for the panel for this particular space. Just to say, you know, the idea here is not a lecture format. This is really meant to get us thinking about the issues and the problems, and then to have a conversation about these issues that arise in this new space for many people in terms of community-engaged research or cluster randomized trials. So I will turn the floor over to Charles now.
Thanks very much. It's been such a pleasure visiting OSU for the last couple of days. It's really been a nice experience. And let me say, what an amazing resource here you have with the Center for Ethics and Human Values. So I'm very pleased to be part of this conversation today. My job is not to sort of say everything, which is good, because I wouldn't know how to. But I'm just going to try and kick off a conversation about ethical issues in this really important area of research, community-engaged research. So what is community engagement? Community engagement can be thought of as a process of working collaboratively with groups of people who are affiliated by geographic proximity, special interests, or similar situations with respect to issues affecting their well-being. And community engagement has turned out to be such an important mechanism particularly in areas like public health, but also broader areas including social justice. Within the public health sphere, community engagement and community engaged research has been essential to programs in smoking cessation, obesity, cancer, heart disease. So really, really important stuff. Community engagement has been around for quite a long time, at least 25 years, probably longer. So there's kind of a fairly received set of principles guiding community engagement and community engaged research. The question before us today, though, is a little bit different, though. It's really kind of what should we view as the ethical foundation kind of guiding community engaged research? And I think that's a lot less settled. So I take that as kind of being the question for the panel today, is how should we, from an ethical standpoint, frame issues of community engaged research? So I'm just going to suggest one possible framing, and then we're just going to talk about it. So let me tell a story. 24 years ago, my first job was at this place. So this is Mount Sinai Hospital in Toronto. And part of Mount Sinai Hospital is this amazing research institute called the Samuel Lunenfeld Research Institute. And part of my job as a bioethicist at Mount Sinai was I was appointed in the Lunenfeld, and I began working with a number of amazing scientists there, including scientists who were hunting for associated and disease-causing genes, right? And two of the scientists that I came to know quite well were Noah Zamel and Art Slutsky. And they were very interested in uncovering genetic associations and causes of asthma. And their searches for an asthma gene led them here, to this place. This is actually Tristan da Cunha, and I bet you some of you have never heard of Tristan da Cunha. It's one of the most remote places on the planet, and that makes it in part of interest to scientists looking for disease-causing genes. So in the 1500s, Tristan da Cunha became populated by ships kind of crashing into it and sinking, and people just kind of got stuck there, and they stayed. So you can see at the very top end of the image, that's the human settlement, sort of clinging to the edge of this volcano in the middle of the Atlantic Ocean. Now, it turns out that Tristan da Cunha has one of the highest rates of asthma in the world. About a third of the population is asthmatic, and that compares to a population prevalence of about 2.5%, right? So it's more than tenfold more asthma here. And the idea is that it probably has something to do with the small number of people who originally founded the population on that island. Given that this is so remote, and given that there's only 300 people here, how on earth do we know that there's a lot of asthma in Tristan da Cunha, right? Glad you asked. It turns out the volcano erupted in 1961, leading to the mass evacuation of the entire population of the island to England, where they were all examined by doctors. And these doctors found, wow, these people have a lot of asthma. And they began publishing about asthma in Tristan da Cunhians in the British Medical Journal in the 1960s. And that's how Noah Zamel and Art Slutsky came to be interested in this island. So they went back from England to Tristan da Cunha. Here's a map of where it is. There's no easy way to get there. It's a 7-day boat ride from Cape Town, and it's a small boat. So they went to the island, and well, they were gene hunting, right? And so they approached people on the island, and they got 97% of the population, 97% of the 300 people to agree to medical examinations, medical histories, a skin patch test for immune hyperreactivity called atopy. They did airway reactivity sort of testing. It's one of the things one tests for asthma with. They collected detailed family histories from people, and they collected blood for DNA. And they got 97% of the islanders to sign consent documents and to participate in all of this. So what did they find? Well, they found a lot of interesting things, but this eventually led to the identification of an asthma-related gene, which it turns out codes for a part of this protein, which is a receptor in the cell wall, and it's all part of one of the inflammatory response pathways. So it kind of makes sense, given that inflammation is a big part of asthma, that there might be a connection here. So that's kind of the story of the asthma genes. It turns out there are about 100 genes that might be associated in some way with asthma, and this is sort of one of them. I became very interested in this story as a research ethicist because I thought, there are ethical issues here that don't fit with how we think about the ethics of research, right? Our standard framework is articulated in the Belmont Report, 3 foundational principles to govern the conduct of research: respect for persons, which highlights the need for informed consent; beneficence, which means that research participation needs to pose an acceptable balance of benefits to risks; and justice, which says that research participants need to be selected fairly. So that's kind of the standard sort of framework, and one that's still in use today, and is sort of frames the U.S. common rule and so on. It seemed to me that this study in Tristan da Cunha didn't really fit very well within that, or at least there were issues for the community, for Tristan da Cunhians who were impacted by this study, that don't fit well within that framework. And just for instance, how did this impact community decision making? I mean, was there sort of actual engagement with the community, and did the community kind of sign off on this? What sort of impact did this research have, both while the study was conducted and long-term, on health resources on the island? What about disposition of data, samples, financial interests? So they were discovering genes which might lead to therapies. There were, pharma was interested, right? So would there be resources flowing back to Tristan da Cunhians? And there were certainly potential reputational impacts on this community in the Atlantic. And I guess I concluded it's really hard to see how concerns for the community in research like this fit within the Belmont framework. Indeed, the word community doesn't even appear once in the document. It's not there, right? And I don't think the authors of Belmont Report had communities in mind at all. It was all about the protection of individuals. And so it led to me arguing a while back, I guess about 20 years ago now, and I'm old now, arguing that in fact we need to supplement the Belmont Report. We need to expand it. We need a new principle of respect for communities. And I guess I'm sort of just laying this out there for discussion today, that this might be a helpful thing for community engaged research. A principle of respect for communities which would confer an obligation to respect the values of the community, and wherever possible to empower, right, to empower and protect the community. right? And fundamentally, the idea here is an idea of partnership between researchers and communities, that in the ideal, at least, something we would strive for is really meaningful partnerships between researchers and communities where there's shared decision-making, shared identification of goals, co-creation of knowledge and social impact. So a lot of this has found uptake, I would say. So in Canada now, we have national guidelines that articulate responsibilities for researchers working with Indigenous communities, right? So that's kind of one kind of community, and so that's quite a well-developed area in terms of operationalizing this idea. And let me just sort of say a little bit about the norms that govern that. There are obligations to engage the community in the development of the study, to disclose information and where appropriate to seek community consent, to involve the community in the conduct of the study, to negotiate storage of data and samples, and to involve the community in the dissemination and publication of study findings. Indigenous communities, though, are often highly cohesive communities. They share a common history, right? And so there's a difficult question, and let me just say I don't have the answer to this question, of kind of how we go from cohesive communities like that to other sorts of human associations that we call communities. Less cohesive communities, and it's a very heterogeneous set of things that we refer to as communities. So that's one of the challenges. So I wrote a paper in Science like 20 years ago, and I was trying to answer this question. There's a big complicated table in there. Please don't look at this table. But it looks kind of sciencey, right? There's a table, there's a check mark. But the idea here, and I'm not committed to the details of this table, but I do think there's something useful about the idea. And one way I thought we could map from cohesive Indigenous communities to other kinds of communities is to really look at whether those other kinds of communities possess relevant social institutions. Because I think part of what needs to be empowered and protected in research involving communities is those social institutions, right? So is there legitimate political authority, right, within that community, for instance? That turns out to be a really key question. So let me say a couple of final things here about how I see this working. There's often conversation about the connection between notions of respect for persons on the one hand and respect for communities on the other. How do these work together? And this has been the subject of some lively conversations, right? And one of the worries is that what I'm suggesting is just handing all the power over to communities, and then communities might potentially do bad things with that power. And so I want to emphasize here that the protections for communities, in my mind, are asymmetric. If the community consents to research participation, individuals may still refuse to participate. That's really important. This isn't a substitute for individual informed consent. And if the community does not consent, then individuals who are identified because they're members of the community should not be approached for study enrollment. Now, so that's an important qualification that speaks to, how we think of respect for persons and respect for communities working with one another. Another important qualification is I think this idea of community consent, I guess perhaps what I'd call community permission now, is really something that I don't think applies across the board to all communities. It applies to communities that have legitimate political authorities that are empowered to speak authoritatively for and make binding decisions on behalf of the community. So community permission is something I think that's only made sensible in the context of, for instance, municipalities, where there's a mayor and a city council who are empowered to make some decisions on behalf of, say, a municipality, or an indigenous community where there may be a traditional leader and tribal council. For other kinds of less cohesive communities, we're talking about engagement, consultation, dialogue, but we're not talking community permission in my mind. Okay, so what I've tried to do here is present just a high-level provisional framing. We're now going to hear about some really amazing research going on at OSU, and then have a conversation about how we think these issues ought to be framed ethically. Thanks.
I will ask Abby to give comments about her work, and she's the best person to speak about her work. But knowing Abby as well as I do, I would just say Abby has done amazing work in the College of Public Health and across campus with working with researchers in the area of cluster randomized trials. And so she has been working in the space for a while, even though she looks quite young, and can relate some of the challenges that her teams have been met with when they've tried to go into various groups and get permission. You want up here?
Yeah, so my first disclaimer is that I am a biostatistician, so as I was joking earlier, I don't actually go out and talk to people in the community. Like, I stay safely in my office and talk to researchers who go out. But so as Pam said, one of the advantages of being a biostatistician is you get involved with lots of different projects. So I've gotten to see many different types of projects that have gone out into various community settings, particularly in the area of cluster randomized trials. So I've been on cluster randomized trial projects at OSU that have involved randomizing counties within Ohio Appalachia, have involved randomizing health centers within sort of a broader coalition of Appalachian states. So there's like 5 different states and 4 different health centers within each state. I've been involved in cluster randomized trials that have randomized schools, and cluster randomized trials that randomize medical schools. And so part of the things that sort of come to my mind as a biostatistician is, what does it really mean for the community to sort of consent to be randomized, right? So that if you think about an individually randomized trial, you can very much sort of conceptualize the individual person understanding both sides and understanding, theoretically at least, what it means to be randomized. But when you're talking about a cluster randomized trial, and the cluster, sort of what Charles was just talking about, sort of who gets to decide that that cluster is sort of consenting to be randomized. And then once you have randomized that cluster, what does it mean to then approach the individuals for consent, and what sorts of biases can come out of it if individuals don't participate? So part of my interest as a biostatistician is sort of what happens when you have clusters that consented to be randomized, and then that entire cluster removes themselves from your participation, so they didn't really want to be on one arm, and then they get assigned to that arm, and now they're withdrawing. That sort of presents some interesting statistical challenges. And similarly, sort of what happens if you randomize the school, and then some of the individuals within that school don't want to be measured or don't want to participate in the study, which you absolutely, I think, absolutely from an ethical perspective have to allow. But then sort of what types of challenges does that present to you as from a statistics perspective? And are there ways that you can sort of mitigate those challenges, both in terms of encouraging and helping individuals consent to participate, but also sort of thinking about how are we going to deal with this problem and let people sort of opt out of studies that they did not initially agree to participate into. So I think I'll stop there. Thanks.
And we'll get one other set of context, so we'll have Susan give her experience, which is going to be quite different, and that's what's exciting about this. So, Susan?
Well, I'm honored to be here. I feel like I'm the huge outlier here. I am a trained architect and a professor in the Department of Design, but my entire body of work is community engaged design and build. So I am the person who actually goes out into the community and works very much face to face with people in order for them actually to have agency about their built and physical environments. So I try to empower them to be change agents for their own physical environments. One of the big questions that I guess I have today is that level of participation. And we had a little lovely dinner last night about different kinds of communications and how you basically can co-create, right? We're in this room, we're researchers, we're scholars, we're instructors, we have many different roles. We're also human beings, right? So that connectivity to each other is kind of a driver for me. And kind of the co-development, as Charles mentioned, kind of the co-creation of the study, I think maybe actually could be brought to the forefront for the conversation to follow, because I think that if you were in a process of co-creating or co-developing that trial, that level of communication that you have with your different sorts of populations might be a way for them to see how might they actually be able to benefit, right? What's that mutual beneficial aspect to the larger research project?
You're going to check the mics? And we'll begin with a few questions that I think are fundamental to working in communities, with communities. And Charles touched on this a bit. But it has to, it's really about what constitutes a community and what has to be in place. Charles, you started to define differences sort of across the spectrum about permissions and who can legitimately give permission for communities. I think I would ask, how are we clear about the right conditions under which people can actually be asked to be an authority about their community? Is it only that they have been in a political process elected, or is there other ways in which individuals are in seats of power? So that sort of broad question about communities and permission. I would say, some of the discussion we've already had is hospital CEOs. School principals, school superintendents, and when we cluster and go after clusters for permissions. So what has to be in place for those people to be legitimate power brokers for permission? And I would say that all three.
You know the answer to this one, right? What's this one? I'll start us off here. So I think one of the really difficult challenges here is kind of an asymmetry between the kind of protections we might frame for people, individual people participating in research. And I think that gives us a nice kind of solid ground ethically to sort of say, right, so we're just going to ground that in sort of a set of rights and interests that all of us share in this room, is that all of us share as human beings. And it gives us a nice solid place to build up a framework of protections for people in research. What makes this socially important, community engaged research so challenging for an ethicist is this sort of heterogeneity of communities. you just sort of think, what do we refer to as communities? Well, it could be a town, right? It could be a neighborhood. It could be people connected by a common history or culture, right? It could be people connected by a disease experience, right? People who come together to affect political change. People who just connect on the internet, some discussion forum. Sometimes people refer to that as a virtual community, so I mean, what sort of defines community? I think is sort of almost an impossible question. Is sometimes we sort of think, well, let's start there. Let's get a definition of community, right? And then we'll sort it all out. And people will come to us and they'll say, we're a community. And then we'll say, no, you're not. We've checked our definition. And yeah, so, so good luck with that if you'd like to go that way. I think, we just kind of have to respect kind of the common language. And communities, to me, say something about a coming together and an identification, right? And yeah, I think you kind of need those things. But beyond that, it can be so many different kinds of human associations. And what's difficult about that is it doesn't give us that solid ground of a common set of rights. Like we've got these rights and we've got these interests and everybody shares that. And so it's very heterogeneous, the sorts of associations that we think we're empowering and protecting. And I think that's the challenge. So, I mean, to me, that's what makes it so difficult. I know you asked about kind of permission and who can give permission, but maybe I'll just kind of start there. That's really the hard problem here.
I'll kind of pick up a little bit because I think that what Charles...
Susan, be sure you speak into the mic, please.
Can you guys hear me in the back now? Okay, thanks for the smile. What I hear Charles beginning to imply works really well in my field, and I'm going to try really hard to make it a little bit more abstract so it can be applicable in your field. And that is this idea that the human connectivity is the first and foremost. So in your field, beginning to think about that study, that research project that you've just got $500,000 to go and launch, thinking about you as the researcher, the scholar, beginning to go into that arena, you now are becoming, or if you put your mindset in that frame of mind of I'm now going to be part of that community, together we're going to build community, you can begin to project yourself as somebody, we're going to co-create this framework for the research study. And for your capacity, did I lose you? For you to have the capacity, oh dear, but they just don't like that word, capacity. Forget the word capacity. If you can think in terms of a framework that's going to enable you to co-create these, the research agenda. Again, you have your own research agenda. You know what you need to get out of it. But being transparent in that, letting the community members know, the individuals, right, know exactly what you're trying to get out of it, and then giving them an opportunity to identify what they need to get out of this, and allowing it, building it out to be an exchange. That's how you can build community, and I would say the human connectivity that's really important. And then I think also that thinking about in terms of that community and people wanting to withdraw, or those subgroups needing or wanting to protect or withdraw from this study, I think our capacity of being honest, truthful, and ethical in the process of co-creating and doing this exchange actually opens it up. And from that point forward, you're building trust. And when the trust can get built, perhaps you'll find less and less people pulling out and retracting from that research study. Those are my thoughts.
So from that, I would say to both of you, we are challenged in the permission language about when does that happen. So if we're going to co-create the study and have the community influence the design, when is the permission sought from the, even if we have a group of individuals that's recognized as being able to speak for that group? So thoughts about that?
I don't know if I have thoughts about that direct question. I will say there's a couple interesting things here. One is to say sort of this idea of defining communities is really interesting sort of from, again, sort of a biostatistics perspective, because sometimes it's easy to sort of sit back and to say like, oh, it's really obvious to sort of think about counties and we're going to randomize counties to these different interventions. And the counties, right, are borders that were defined at some point to try to make up communities in a sense, but they may not reflect the current reality, and sort of thinking about how to really go and sort of make communities that make sense currently and not just based on what is easy and sort of straightforward from sort of a more design perspective. And the permission aspect, I'll talk a little bit more about the study that I was involved in where we were randomizing schools. And so they would, not me again, I don't actually talk to people. The PIs would go to the principals of the schools and sort of explain the study and talk about these two different arms and talk about how they were going to be randomized. And the principals really were having a very hard time sort of with this idea of sort of conceptualizing how they would implement the study within their very busy school day, sort of randomized to either of these two arms. And it's not so much they thought one arm was going to work better. They were really excited about the project was trying to reduce obesity in Appalachia high schoolers. They were really excited about the project and really excited sort of about the either arm. Like they were excited to have somebody come in and try to help their students with this. But they were having a hard time sort of with these two very different ways of trying to reduce obesity that we were going to randomize them to. And sort of getting the permission at the level of like, we need you to consent to be randomized, they were having a really hard time with, and we only got about 50 to 60% of the schools agreed that first year. And what the researchers came back to me and said, well, could we possibly randomize the schools ahead of time, sort of get a list of all the possible schools that we could approach and randomize them ahead of time, and then we could approach them saying, we really want you to participate in our study, here's the arm that you would be assigned to, that was randomized, right? So it's not you're picking, but you were randomized ahead of time, and then sort of help them sort of conceptualize how that would look like within their school community. We got much, much better consent from principals to that approach. So the second year we did it that way, we got all but one of 13 schools to agree, so the consent rate was much, much higher because they could conceptualize better what the study would look like. So sort of that's somewhat at your question in terms of when do you seek that permission and what are you really asking them to do?
I think permission is a really important question, and it should be immediately followed up with another question, which is permission for what, right? And I think that really matters because that it just sort of implies conversations, I think, with different people, different entities potentially. It might be permission to come onto our land or permission to come into the school, right? It might be permission to use our resources, both in terms of people or health resources or financial resources. It might be permission to implement an intervention, permission to initiate a dialogue, permission to use our data, and then permission to represent us publicly, right? And those might all be kind of different conversations, and certainly if you think about, so I think school-based research is really pretty interesting, and you know, sort of it's a nice example of so it's not exactly a community, but you know, it's I think there's some real similarities between kind of communities and organizations. And it's like, so there's an idea that we should probably talk to the principal. Good idea. But for what, right? What is she kind of giving permission for? And it's certainly like to enter the school, and it's certainly to, involve our staff, and it's certainly implications for resources, and there could be liability issues and so on, but it isn't for other things, right? It certainly isn't giving permission to intervene on students in various ways. It isn't permission for their data, because that's not within the authority of the principal, right? And so I think analogously with communities of different sorts and of different sorts of research studies, we would need to sort of start with that question, which is permission for what?
I think the only thing that I can, much of my work has to do with community engaged design build. So the building out of the physical environment at a lot of different scales. But before designers, architects do intervention, we enter the community with what I call, or tell my students, are active listening skills, right? So we actually, before we're asking for permission, we're actually listening a lot to what their needs are. So if we're going for community identified needs, reducing obesity in Appalachia high school students, that's a need. We have the resources, the scholarship, the wherewithal to actually help them with that, right? So what we're trying to do is really listen carefully and be observant and understand the critical structural conditions of these different communities, neighborhoods, social groups, so that we can be really smart in our processes of engagement. And again, the types of conversations that we have at the onset is critically important for the success of the project outcomes. So keeping that in mind throughout really kind of establishes a certain kind of integrity, not just with your own work, but now this relationship or sets of relationships that you're building is this integrity and this trust in the relationships that you have moving forward.
So I have one more sort of general area of questions, and then we'll open it up for the audience. But that's the way in which community engaged research interfaces with IRBs. So when we do research, we're often required to think about how we're going to do that if human subjects are involved, and how we do that with, at least in the US, an IRB process. And I think, again, Charles sort of started the conversation, or at least said something about the common rule and the IRB requirements not being a perfect match. I would like to have a beginning discussion, so that will hopefully stimulate some questions also from the audience about that tension in terms of how you do community engaged research in respecting these sort of fundamental moral ideals, when you've got a IRB process that sometimes you feel like it's I think the analogy might be it's a square trying to put in a round peg or something like that. So it just doesn't fit very well. At least that's been a lot of my experience. So, I mean, Abby, do you have an example of where that popped up, or Charles or Susan, sort of an example, and then begin to talk about how you see those tensions between this kind of work, whether or not it's a pragmatic trial or a cluster trial or community engaged research, And I would say specifically for you, Susan, how have you thought about your interface with an IRB with this kind of work that you do in communities as research? So.
I think I need more time to, I mean, it does sometimes feel like a peg, cylindrical peg going into a square hole, that's for sure. On the other hand, I think maybe if anything from that 30,000 foot perspective, it makes me very, very conscientious of everything that I do. Which is, you know, I mean, I want that there. Almost all of my work is qualitative data collection, and so the experience of my engagement is actually what I'm trying to gather, so that I can learn from that. So for me, in that active listening, you know, I'm training my students to do active listening and then getting them to do reflection on it, so I can see what prompts am I giving them or not giving them that they're able to be basically metacognitive thinkers for themselves, so they can begin to educate themselves when they are engaging with communities in the future. The idea is that they're going to go out and continue to do what I call social impact design or social innovation design, and they need to have that experiential learning in the classrooms, in my studios, in order to be those impactful, civic engaged, civically minded people after graduation. So IRB is a challenge, but it's a framework, I guess, that I use, and my students are quite aware of it as well.
So I'm not sure that I have a specific example where the IRB has sort of been a direct challenge. In my experience, actually, with a lot of the cluster randomized trials, both that I've been on and that I've sort of heard about that have happened elsewhere in the country, I almost want to say that the IRBs have not actually done this they have such a hard time with this sort of concept of what does it mean to have these community-based projects or these cluster randomized trials. And they sometimes, I think, in my opinion at least, are sometimes too lax in thinking about how to protect both the community as a whole and the individual people, and sort of because it's cluster randomized and because there's a lot of people, like, sure, it's no problem, like, you don't need to seek individual consent some of the times. I mean, so this was the subject of his talk yesterday, but sort of and so I think that sometimes can give researchers sort of a false sense of that they're doing the right thing, because they can sort of push things through these certain IRBs without sort of having really thought about the implications of their work.
I agree. I think it's a challenge not only for researchers, it's a challenge for IRBs, right? And I think for reasons that I highlighted at the beginning, there's just kind of a fundamental kind of lack of fit between the rules under which IRBs are operating and the sort of, you know, the real ethical issues on the ground that the researchers are dealing with. And so to me, this as, you know, because this process needs to be about the production of socially important knowledge in a highly ethical manner, right? And so that means researchers need guidance that's specific and appropriate to the context of cluster randomized trials, and also to community engaged research. And I think that's something that would be a benefit not only to researchers but to IRBs as well, who struggle to sort of, you know, the common rule doesn't say anything about communities and community level permission and all this kind of stuff that we're talking about. It isn't in the common rule, and so it's a challenge. But I think it's also an opportunity for, you know, us to work together, researchers to work together with ethicists and regulators and government to come up with sort of sensible guidance, sensible and effective guidance for community engaged research. It's really socially important research, and it's going to be the way that we affect important public health change in the future. It's the way we're going to affect important social justice change in the future. So it behooves us to kind of step up and help create ethical guidance that's really relevant to communities, that's relevant to researchers, and that helps IRBs do their job.
So I think that's a good place where we can start to entertain questions, comments from the audience. Lav will take one of the mics and come around. And so people, we have questions? Lav's really in charge.
Hi, thank you for the presentation. This was really informative and helpful. I have two questions. The first is following up immediately on the IRB question. Sorry, following up on the IRB question of doing collaboratively designed research and implementation sounds like a very iterative process. So how do you balance that with the very linear process that the IRB imposes on research? And then the second question is, I'm a political scientist, and so for talking about communities as defined by leaders, what if leaders are part of the problem within the community or limit access to that community?
Those were excellent questions, and I have no idea. All I can say is that almost every single, both questions were really great, and there's no easy answer to either of those questions. Every single design project or research design project is nuanced, right? And I think while I have a very, very high moral ground, the IRB for me is like, well, of course I'm gonna do it that way, right? It seems like I can, for me, I try to have the really good conversations with my students so we're in the same headspace. And your question about the IRB seems to be kind of a linear process, whereas our projects are often iterative. And usually I end up talking face to face with somebody looking at my IRB, so I can make sure that, you know, one focus group got this, but I need to actually do that a couple times. And so I will, you know, rewrite or have those conversations with folks in the office. As far as leaders go, in community engaged work, that's typically an issue. I tend to work with youth, urban youth, and populations of people unsheltered. So I don't often, there might be like a symbolic leader of sorts, but I'll describe in IRB kind of my specific, the focus groups that I'm working with.
So there's a lack of fit between how community engaged research works and the IRB process, right? And it's because the IRB process was designed for different research, right? And you know, it's right. You write a protocol, right? You send it to the IRB, they approve it, you go away, you do the research, you provide, you know, annual updates, and then you close out your study when it's done. And community engaged research doesn't fit well with that. Because you know, as you've described, the starting point is well, You're going to go out and sort of see if a relationship with a community is possible, right? And you're going to have some conversations, and you're going to see where that goes and see what the community wants to do, see if that's something you want to do and are able to do, and then you're going to kind of come together and figure out how you're going to do that. And so the protocol comes very late in the process as opposed to at the beginning of the process. And I think that's a real challenge for IRBs. It's just sort of weird for IRBs for you to say, all right, can I have your permission to go out and try and form a relationship with a community? So it just doesn't fit. And I think we should just, acknowledge that and just sort of say, well, we need to think more creatively about how the IRB process can be adapted to meet the needs of this kind of research. So bad leaders. Yeah, that's an issue. That's a political issue. It's a moral issue. So I like to think of this in terms of not just political authority. I mean, all sorts of people have power, right? But not all of them should have that power. And so I like to think in terms of legitimate political authority. And I think that's sort of a two-way street. It's not only, does someone occupy a particular position of power, it's also, are they viewed by the membership of that community as legitimately possessing that power? And so long as those two things line up, you're fine, right? The more they pull apart, the more you're not fine in terms of in terms of the kind of permissions that you might be seeking from a putatively illegitimate political authority. But I think we do have some language there, and we do have some concepts, particularly from political theory, to help us there. So I think there's some ideas that we can bring to the table for that, at least.
Thank you very much for a very interesting presentation and discussion. My name is Holly DeBelko-Shoney, and I'm a professor in the College of Social Work, and my work is all community engaged research. And I'd like to pick up a little bit more on the discussion around power and power in communities. In particular, when we talk about power differentials, when we talk about all of the isms. So in my work in particular, that looks like ageism, and that people who may be the head of communities, a long-term care community, long-term care services and support organization, those organizational leaders have the legitimate political power in those organizations. The people, the residents or participants of those programs see those individuals as having that power. But when in reality, there are a lot of assumptions that are made about the abilities, in this case, of older adults, but you could substitute lots of vulnerable populations with that older adult group, and make assumptions. So I'll give you one specific example of a research project that I was involved with that was around equine assisted therapy with older adults with dementia. We had a tough time convincing the leaders of organizations to allow us to recruit older adults that were receiving services in their organizations for this project. The older adults themselves, the family caregivers, they were all interested. They all believed that their mom, dad, aunt was in a position to make an informed decision about whether they wanted to participate in this equine assisted therapy project. So I really am interested in the panel to kind of push the panel a little further to talk about power differentials within communities and navigating that asymmetrical piece of individual versus community, and how that legitimate political power are based around those people who are of privilege. And when you're a vulnerable person, it's difficult to question those people who are in power, because that could affect your overall well-being. So just would like to hear some more reactions from the panel about that.
Power, come on, you know lots of power.
I know about other kinds of power. Yeah, so I think it's a really interesting issue, sort of the idea that that essentially the leaders could potentially foreclose opportunities based on that sort of power differential. So again, not an ethicist, but I do think there's sort of, so from a statistical perspective, there's some interesting things about that too, right? So if you're differentially excluding people who are perceived as being more vulnerable, you have interesting issues in terms of how generalizable are your results, and also like, do you have evidence that what you're doing would work if it would be sort of pushed out? So that if you sort of think about that only the people who are perceived as being more able to consent or more able to sort of take part, then you have lots of evidence that your therapy would work among those people, but not any evidence that it would work in people who are less, who aren't asked to be participating. And that's sort of an interesting, you're sort of further disenfranchising, I don't know the right word, you're sort of further excluding them from benefiting from potential things, and I think that's really problematic.
Yeah, I mean, I think these are really important concerns, and it's good that we don't just have a principle of respect for persons and a principle of respect for communities, right? Because issues of disempowerment of people who don't have a voice within communities or institutions, to me, most fundamentally raises these issues of justice, right? And part of what we should be very concerned about as a society, and what researchers are also concerned about, I know, is kind of using research to give people a voice and to rectify disempowerment. And maybe at times to challenge authority. And yeah, I'm down with all of that. I mean, I think that's really important stuff. And so I think justice is a central consideration here, and it's a principle that we need to continually remind ourselves of its power and necessity. There are so many issues, I think, with just as soon as you said sort of nursing homes and their clients, I thought of a fairly recent sort of cluster randomized trial looking, it studied more than 50,000 nursing home residents in the United States across 823 nursing homes, looking at kind of high-dose flu vaccine versus regular flu vaccine. So it's an issue for the elderly is that regular flu vaccine just doesn't work as well. So if we use high-dose flu vaccine, would that protect older people better? So that's all good. I mean, that's an important question. The problem in my mind was the way that got rolled out. So nursing homes were randomized to give high-dose flu vaccine or regular flu vaccine, and the nursing home directors just sort of signed off on that, and there was no individual informed consent from any of these 53,000 people who participated in the study, and then they looked at routinely collected data. So you've now got a study where, although both of these vaccines are licensed by the FDA, there are 53,000 people out there who participated in research, and they don't know. They don't know that. And that's not okay. That's very far from okay. And it's an instance, I think, of where someone in a position of power, a nursing home director, and researchers working with that person, they didn't think carefully enough about what is the, what are the bounds of that authority. It certainly extended to what goes on in the nursing home and how staff and clients are impacted, but it didn't extend to including people in a vaccine study without their permission. So yeah, and it's I mean, I think, when people are, there are fully autonomous people in nursing homes, right? But there are also people whose autonomy is in a state of change, right? And it seems to me, when you're taking choice away from someone whose choices are already due to circumstance changing, there's sort of a special injustice that goes with that.
Just a question, was that approved because your sort of thoughts about people think that cluster randomized trials are easier to get approved? Did they waiver the consent? Is that what they did in that trial?
Yeah, I mean, I just think it was, so it's a new and complicated design, but this is, it's just one example of many of the sort of failures that happen because we're dealing with new kinds of research that involves nursing homes or hospitals or entire communities, and we don't have kind of an adequate conceptual apparatus for that. And there's a lack of fit with the rules that IRBs have to follow. And unfortunately, that leads to mistakes like this, where people are wronged.
Thank you very much to all three of our speakers. Just to jump a little bit off the previous point, and maybe ask for it to be opened up or unpacked a little bit. So I am also a faculty member in the College of Social Work, and my research is with LGBTQ plus communities. And one thing I've been thinking about as Holly asked her question is the idea of justice and and more particularly the idea of structural injustices and how they are replicated in communities, because I think as we've been talking about communities, we're talking about them on one identifier, right? But the LGBTQ community is a great example of structures of racism, of classism, of heterosexism, cissexism replicate in who is given that idea of legitimacy to speak for a community that is actually composed of communities who are quite disenfranchised and disempowered within their own system of community. So in thinking a little bit about that and those structures of power and the idea of justice and our responsibility as researchers to challenge those structures, right? And not, like you had spoken to, push back against the IRB, but even more strongly to make statements about what is right and to be a spokesperson with a significant amount of power for the most marginalized in those communities. So a little bit about that, and then extending a bit, you had talked a lot about that idea of community engagement and community building early in the process, right, during the informed consent and the idea of capacity to consent. I'm wondering if you could speak to the idea of how that process continues across the research trajectory. And I'm particularly thinking CIHR is a great example of funders who are beginning to focus more and more on knowledge mobilization and the importance of that and how that also is devalued in the academic process. So like how the structure, for example, of tenure does not promotes you publishing a peer-reviewed article your community members will never read, but does not promote you doing public presentations or reports. And they're just the idea of value and the idea of engaging with community and being ethical and engaging in true community engagement when, again, those structures of power are replicating themselves in the process of your research and your community-based research. Thank you.
Lots of little nuggets of questions in there.
Yeah, sorry.
All right, so I'll start because this will be quick, and it just goes to your sort of last point about sort of the getting back sort of the knowledge dissemination to the community itself who participated in the work. And this is just a quick anecdote. So one of my other projects was looking at a survey that we did through Facebook in the dog agility community. So this is people participating in agility with their dogs. We had a survey to do injuries among those dogs. And as we're sort of starting to write out the paper, one of the things that the PI did, who's very new to research, and she is just sort of just a staff veterinarian, so like not fully sort of indoctrinated within the tenure process. And she was like, I really want to make sure that we can publish this in a sort of free online space so that the people who participated, the 4,000 plus people who participated, can really access the article. And it was just sort of, as you said that, I was like, oh, that's exactly what she was doing. And like, it was so foreign to me, which is sort of disheartening, right? Like that I've been at this university for 10 years and like had never really thought about how to sort of make sure that that data gets back out to the people who really provide it, how the information gets back to the people who participated in the research and provided the data. Exactly. Exactly. Yes. Right. Exactly. Right. I mean, so it sort of both was sort of an anecdote about that, and to sort of think about like how we could better get it out to the people who participated. So yeah, thank you.
So thinking through that word, it's a fancy word, but really taking it to heart, co-creation, right? What does it look like in a peer-reviewed journal versus what does it look like when it's going to be accessible to a much broader audience where they can actually use it? Or in my work, a nonprofit, oh my gosh, a nonprofit who can use that data and put it in their funding grants for more monies, right? So yeah, co-creation, co-development, mutually beneficial, elevating the underserved, amplifying the voices often unheard. I think at the end of the day, if we can, even those directors at the facility that you were working with and trying to demonstrate the equine, the benefits of the equine therapy, I think that human, they probably want to do the right thing. They're going to want to know how much it costs, but they're going to want to do the right thing. And I think our roles and our responsibilities are to demonstrate why that is so beneficial to the people that they're in service to.
Other questions? Go ahead. I'm here. Well, we can hear you in the back.
First, I want to thank all of you for this today. I'm Jan Weisenberger, and I'm the Associate Vice President for Research, and one of my jobs here is to help facilitate exactly this kind of research. But one of my other jobs is I oversee all the in-house IRBs. But I heard this sort of interesting dichotomy in what you were talking about with respect to the IRBs. On the one hand, the current IRB process and the linear way that IRBs think about research studies doesn't fit well with this iterative process of community engagement. But on the other, it almost sounded like you sort of wished that IRBs could give you some good guidance. So my question is, how can you as community engaged researchers help us to create an IRB environment, process, whatever, that truly could be an active exchange? So how can you guys help us?
Yeah, that's great. I mean, so yes, there's new and exciting, socially important research that's happening that doesn't fit well within existing structures. So, I mean, there's an opportunity there, just as you're suggesting, for people to come together and have a conversation about how this could work, and those are needs that aren't just local; they're national and international. And some of my work has been about generating that kind of missing guidance for cluster randomized trials internationally, and that of course needs to be translated into institutional policies as well. So there are some documents out there that I think can help in some of these challenging designs. So we published a piece called the Ottawa Statement on the Ethical Design and Conduct of Cluster Randomized Trials in Plos Medicine in 2012. It was endorsed by SACCARP in their guidance on cluster randomized trials in 2014. I mean, as your institution sees more cluster randomized trials, I think there's an opportunity here to translate some of that existing guidance into local policy, understanding that the common rule, just kind of doesn't cover everything here. So there is, that's just something, that's one possibility. But what we're talking about here is broader than cluster randomized trials, of course. And I think in the context of community engaged research, it'd be wonderful to just bring together, some of the outstanding researchers that you have here at OSU. I mean, I think it'd be really cool to be inclusive about this conversation. I mean, bringing, let's have some members of the community at that table, right? I mean, let's engage them too. Why not? And talk about how local policy and structures could just, begin to improve the fit. Yeah. Cool.
Give form. Yeah, I was just going to say, Jan, that maybe one possibility is to actually think about this as backwards designing, right? So you have some community engaged research projects that have gone through IRB and they're done, right? These projects are complete, and then you backwards engineer them to see what questions did IRB really need to have in there, and to make it's a fun process, and to make it super inclusive so that you are getting, and I'm now really very much speaking about kind of the social behavioral parts, because I luckily don't ever have to draw blood from my community partners. But anyways, so do this backwards engineering with a number of your community engaged scholars on campus, and have them basically unpack the project that they did, and then begin to align it with what were those IRB questions that we asked that allowed them to do that. And you can begin to see, as the scholar in this field, where they went off track. And from there, you can start to maybe build a better framework that will get closer to our round peg and our round square hole.
And just a comment, we actually started this conversation this morning with the IRB. So Charles met with members of the IRB leadership to just talk about how we might go about this, just to
Well, it's something that we struggle with, trying to make sure that we're providing the right kind of guidance for all kinds of research at the institution. And this one's tough.
Yeah.
We probably have time for.
So I'm curious how that it's okay, who is even someone that's sort of agreed upon as the representative for a community, you know, how do you know that that's still okay to stop there and that to be the person? Let me give you a couple of examples. So, if your community is people with a certain condition, they aren't geographically connected. They're, you know, and maybe even more so in particular if they had a rare disease or something. But you know, I can think of one particular rare disease where there's a very rich person that has the disease and has become the voice and makes a lot of decisions and tells researchers who, if they want to do research with this rare disease, this is one of the few resources they have. So that person has a lot of influence. If they don't represent, you know, that community well, and then if that community, not to go all Edward Snowden, but if that community doesn't even know that they don't represent them well because they don't know what their options are, they don't really understand, they're just happy somebody's advocating, you know, or something a little bit more common, maybe not a rare disease, where a foundation was established, let's say 40 years ago, and suddenly like everyone just looks at that foundation as they're happy that it's there and it's speaking for us, but they become advocates and they go to Congress and they're doing all these and making lots of decisions, but they're driving the research. And average person with that condition doesn't know much better, and would maybe a lot of people wouldn't have made the same decisions that they do. So I don't know where. Just if you could speak on that, that'd be.
Yeah, I think that's a great illustration of how careful we have to be about the question of permission, right? And there are all kinds of communities, you know, and I think where the idea of a community where people come together over a disease experience is a great example, and that's just a case to me where I just don't see any role for community permission. I mean, there's nobody there who needs to say it's okay. So I think community permission comes off the table for that kind of study, and it now becomes much more about the engagement process, and it's how do researchers engage with that community. And I'll bet it's really tricky when you've got sort of one really loud voice in the room and a bunch of kind of people who don't even know that they have a voice, right? And I'm guessing that one of the challenges is to hear from everybody in that engagement process. But I don't think that's a question of permission. I think it's a question of respectful and just engagement.
I think we're about out of time. Charles is on a tight time frame here, so yes. I want to thank everybody for taking time to come today, and I want to thank the panel for being with us today. So thank you all.